a little mantra for you this evening, my friends. The best way to cure a disease is to prevent it. Is it really possible? Let's check with Dr. Ambika Nair in Aware and Care, your weekly herbal Ayurvedic program with Dr. Ambika Nair, who's the co-founder and chief consultant at Santhigram Group of Companies, and I'm Madhavi Bathula. Let's welcome Dr. Nair. Namaskaram, Dr. Nair.
Namaskaram, Madhavi. How are you doing?
I'm doing very good, Dr. Nair. I just released a mantra to our viewers saying the best way to cure any problem is to prevent it. Is it absolutely right?
Absolutely right. You're always right.
So in this little capsule series that we've started in the sections from Aware and Care, how to prevent certain disease. We've been talking about conditions and symptoms, how to cure it. And as you suggested, that the best way to take care of this is in the starting phase. Don't let the problems come in. A common problem, we've spoken about it before, and of course, you will add more light to it, fatty liver disease. Let's have a basic definition of it, and then we'll go towards preventing it.
Fatty liver disease, there are two types of fatty liver disease. One is alcoholic, one is non-alcoholic. Even, you can see in some ladies, with the pregnancy, they will get a fatty liver. Even some medications, it can be seen with the diabetic patients. Like a consumption of alcohol is more, even with the malaria. I have seen so many cases in, like a hepatomegaly and all in India when I was practicing a lot. Okay. But for this, this is accumulation of fat in the liver and the changes will come and it can become like a worse, like a cirrhosis of liver with so much of accumulation of fluid, like, ascites and all. But this all, like in the later stages. But what are the common symptoms you should know? How can you make out? You are very, very, like you get tired, like anything, so much confusion, you cannot concentrate, like a very poor judgment. You cannot analyze yourself that people will come and tell, I cannot understand what's happening with me. I feel like nauseated, like, like a vomiting when they see the food, like a little bit of like a weakness will be there, a loss of appetite. Even some people will have a loss of weight because they don't eat much, like fatigue, that is more common, actually feeling very tired. In certain cases, when they come to us, we can even see, we will even complain, some people, a little bit of a stomach ache, like a moving pain. On examination, we can see, find dark patches on your neck, even on your underarms and all. We always say like that, actually. And, their face itself, appearance itself will be so fatigued, so tired.
Okay. So these are a couple of symptoms, and I know I'm smiling because we tend to generalize most of the symptoms and everybody feels in today's lifestyle that they have this. But I think blood test and other aspects also have to be
then
detailed diagnosis.
That their liver enzymes will be on the higher side, ultrasound will show. There will be hepatomegaly, like whatever, the condition, it will be, whether it is grade 1, grade 2, or accordingly they will tell. Some days it will be a little bit of fatty liver that will also be taken care in that, actually.
Okay. And what is the worst case scenario in fatty liver? Because if somebody is not taking
cirrhosis and all, like.
Okay.
That, that can happen with anybody, like sometimes it will be. So many times, because there will not be any symptom also. When it is like in a very bad condition only, when you go to the doctor, they will say that already.
So what about cholesterol and triglyceride? Well, that does.
Yeah, this all, because liver is the, like everything is being digested over there, that absorption. So, fat has to be absorbed over there. It has to be, even glucose has to be released. Liver is the important organ in the body, especially our everything, even your obesity is related with that. Metabolism is over there. So, like, you can see like, oh, my tummy fat does not go out. So this all related with that only.
Wow. Okay. And
So
any
if you
age
take
group?
care of the liver, you're always perfect.
We'll definitely get to that, Dr. Nair, because I'm excited to know what are the ways to prevent it. But just quickly to understand, any age group gets affected with this, or there are any specific
any age group is affected, but normally between, like 20 to 40, some days even like a 60 and all, any age group, but mostly because actually, eating habits, you understand, that is there. Sleeping, eating, they don't, so much of stress. See, like especially like they don't sleep. Sleep is more important in this, actually. I have seen that, like they don't sleep. And so naturally anorexia will be there, like they can't eat much. So this all, like.
Okay, friends, we've now understood what are the symptoms. And in our previous episodes, we've spoken about how to treat fatty liver disease. So please definitely refer to that. But today we're talking about how to prevent this. Prevention is better than cure. So Dr. Nair, please detail to us for different age groups how to prevent fatty liver disease.
First of all, your eating habits, you have to have a lifestyle change.
Mm-hmm.
When they come to us, we will tell that whatever they were eating, some people excess of like any fatty food and all, which is not being digested, that should be avoided. Like deep fried food and all. Balance the healthy diet, like limit extra carbs. From the food schedule, like such as overeating the bread, like grits, so much of rice, potatoes, so much corn. Cut down consuming even sugar drinks, like like a sport drinks, so many juices, so many things, like rich with like sugar has to be like reduced actually. And eating before, like especially sunset, like at least by 7 o'clock or 6:30, according to our like a working time and everything, that is more important. And eating in time, don't skip the meals, but you should eat. Now, so many are doing intermittent fasting and all, but it all depends upon the body type.
True.
So, like, so some people it will work, but when you have a problem like this, then you have to eat small quantities of meals, which will assimilate, like digest and assimilate in you.
Okay. And when you talk about meals, what kind of foods are enriching for fatty liver disease?
Only cooked food, actually.
Okay.
Easily digestible, that like a sattvic, like even khichdi we will give. According to the constitution, we have to treat them, actually.
Okay.
We always tell them, like eat food rich with the vitamin, like E, like sunflower seeds are very good. Almonds are good, like pine nuts, peanuts, spinach, like arrowroot, flaxseed oil, soya bean, even pistachio, broccoli, carrots, like all the, like leafy vegetables like mustard, turnip greens, mangoes are very good for that. Nuts are very good. Even papaya, pumpkin, red pepper, all these things are very good in that actually.
Okay. So these are certain foods that you're talking about which can help in preventing fatty liver disease.
Yes.
So these are also foods which detox the liver, because this is a term.
Yeah, that I will come to that actually. Okay. Then, like even food rich with the fatty acid, like omega, omega-3. Flaxseed is also very good. Walnuts, sardines. If you're non-vegetarian, you can take salmon, soya bean, tofu. Even shrimp is advised, like Brussels sprouts are very good in that case, cauliflower. Even winter squash, fish oil, krill oil, chia seeds, so many things are there. Even canola oil, everything is, like even food with rich with the vitamin D. Yogurt is very good. Cheese, orange juice, zucchini, tomato.
Wow.
Cod liver oil, fish, or, like oysters, fortified, like soy products and all. Even ham is very good. Dairy products, egg, everything, mushroom, but quit alcohol.
Okay. But Dr. Nair, when you're mentioning all these foods that you're talking, there is a myth that these create heavy weight or something. Now, when you mention krill oil and fatty, omega fats, you can take it in capsules also?
Capsules also, capsule form only, because actually otherwise, it taste will not be good,
Okay. So because when you mentioned so many foods, they're so much rich in so much of nutrition and fat also. But these are healthy fat.
These all very healthy only. Actually, which will, like digest actually. And if you're taking, like malnutrition also causes all those things, certain drugs also, like even people take a lot of iron, even that can cause, like one of the reasons for our, like liver diseases.
Wow, that is some revelation here, because doctor, if somebody is anemic and they're taking iron and they go on excessive of it.
Too much of, that is there.
So friends, see, when we have such conversations here with Dr. Nair, in the process, you come to know about a lot of other things, because you must be going on a path for a treatment and not understanding an underlying factor as to why certain things are happening. Now, Dr. Nair just mentioned about iron pills or taking excessive iron. So have it in a balanced form to get it further. So Dr. Nair, are there any drinks that can detox the liver, help to keep the liver healthy?
First itself, see in your kitchen what you can do.
What?
Okay. take, squeeze a lemon.
Okay.
Half of a lemon, because here the lemon is quite big. Okay, then, you can add with warm water, just drink it. It will 100%, detoxify the liver, and, that your bowel movement will be good. See that, you should not get any constipation also. That's why we always tell them to take Triphala Kashayam, or like a half teaspoon of Triphala in glass of water. You can always take it that.
So when you say this lemon water, it's empty stomach or any time of the day?
Empty stomach.
Okay, empty stomach. Okay.
And, people like to take, they will always come and tell me, I take what you call turmeric with a little bit of cardamom and cumin seeds. Then, mix with the honey, and warm water is also very good. Even dry garlic powder. Otherwise, you can boil 2 cloves of garlic with a little bit of long pepper and haridaki. That is also very good detoxification.
Wow. Okay. Very simple and easy to process.
And amla, our Indian amla.
Okay.
Yeah.
Amla powder.
Amla powder is also very good. Otherwise, you can always take a little bit of, you can grate it, because we get only frozen one over here.
True.
So that also you can just keep it for some time, and, then you can use it actually early morning. You can boil it and take it. It's very nice actually.
So Dr. Nair, I'm sure there must be somebody who's watching there and saying, Dr. Nair, I have tried all this, but I'm unable to sleep. And maybe is that the reason that my fatty liver is still there? So can you suggest something for somebody who are having sleep issues only and leading to fatty liver?
Sleep issues, they should come actually, because they can, apply a little bit of oil. Some medical condition will be there, just like that telling, they will tell that you told and it did not work for me. Okay, I don't want that actually. So see that, so much of kapha related food should be avoided. That's why, carbs should be cut down.
Okay.
And you see that, your taste of the tongue is more important. If you have a bitter taste or anything like that, you see that you have a problem, and see that you don't get into constipation.
True. Okay.
See, one day when we travel or anything like that, that is fine. But if it continues for a long time, and, with laziness, too much of laziness, because this is all kapha related only. But then you have to see a doctor actually.
Absolutely. Dr. Nair, thank you so much on that. Friends, the message is very clear. These were certain home remedies for preventing fatty liver disease. And if you're already in the condition where you are having fatty liver disease, you have to consult a doctor, take proper course of treatment and medications. These are certain home remedies to detox yourself. And yet, if you do not see any results, the message is very clear. A doctor's medical attention is required for your body. And with that, we take your leave, and hopefully we'll see you very soon. Again, friends, continue to like, share, and subscribe the episodes Aware and Care, and specifically the segments Prevention is Better Than Cure. Thank you so much, Dr. Nair, for today's episode.
Thank you so much.